everyone. My name is Natasha Verma. I am the Assistant Professor of School of Nursing in Noida International University, and today I am going to discuss about nurse-patient relationship. This is a very common and basic topic which is used by nurses in healthcare setting as well. So it's a very basic topic. So we'll start. So as the name suggests, nurse-patient relationship, which means it's a relationship and interaction between a nurse and a patient, and it will be a interactive relationship between client and the nurse, and it is especially materialized into therapeutic environment where the nurse and the patient works together to achieve the target of the health related needs of the patient, and to attain the health related need of the patient, or to make the resolve or to make solutions to uh, release the challenges of the patient, or to ease the challenges of the patient in a hospital setting or in a healthcare setting. So basically that is a trustworthy relationship which is among the patient and the nurse and the other healthcare professionals, like nurse to patient, patient to doctor, doctor to nurse, and it will be a chain, it will be a continuous process. As you can see, the nurse patient it is a interaction, as I have told you earlier, that it is a interactive process which is performed or materialized into a hospital environment or a therapeutic environment where the goal is to, or the objective is to meet the health related need of the patients. There will be multiple patients, and that multiple patients may have multiple requirement at a time. So nurse have to understand the phenomena, understand the situation, and nurse have to make solutions for each and every problem. Now I'll come to definition section of the portion. As you can see, the nurse-patient relationship is defined as helping relationship, where there will be a rapport, a trustworthy relationship. There will be mutual trust, mutual respect, faith, hope, each and every feeling, or the gratification need, the sensitivity towards self and others, everything has to be mutual. The where the nurse will show the sympathy, empathy, emotional support, psychological support towards a patient, and the patient, at the time the patient has to collect all these requirement, and also have to cooperate with the nurse, so that that is why I have said it's a mutual relationship between nurse and the patient, which is performed in a hospital setting, whether it is a medical care hospital, whether it is a surgical care hospital, whether it is a maternity care hospital, whether it is a pediatric hospital, or a psychiatric hospital. Everywhere the nurse patient relationship, or the interactive communication between nurse and the patient, should be there. I'll move forward. Now we'll see the goals of nurse-patient relationship. Every process has some objectives, some goals, as we can see here also, goals, the first goal will be help to understand his or her problem. His or her defines patient, whether it is a medical condition problem patient, or a psychiatric patient, anxious patient, or a child, or an old age person, or a pregnant lady, or a lactating women, or a community people. A nurse have to, this relationship has to be established to understand the basic problem of the patient, what he is suffering from. The nurse has to understand this first. Then the nurse will help to cope with the present problems of the patient. The nurse can help the client to cope up with the situations, like if the patient is anxious or the patient is in uneasy state, the nurse can help out the patient to ease the symptoms of, ease the current existing symptoms of the patient. And she can also, or nurse can also help out the patient with the cope up in the situation, how to deal with the situation, how to tackle the situation, or how person can respond to particular situations. Now the third, find out new alternatives to the problem. So nurse patient relationship is not about understanding and to give or to cope and cope up. It is about to give solutions, to give alternatives for that particular problem, where nurse can provide multi n numbers of alternatives, or can provide multiple solutions for one particular problem. Now we'll move to the phases of nurse patient relationship. So as you can see in the screen, there are 4 phases of relationship. As I have told you earlier, that uh, it's a process, not a just about interaction. It's an entire process. It is started from there only when the patient is admitted to the hospital, and it will ends with the when the patient get discharged or referred from the hospital. So it has divided into, or it has characterized into 4 phases. As you can see, the first phase is pre-interaction phase. In pre-interaction phase, it's a first phase, as the name suggests, before interaction, before face-to-face meeting with the client. And the second one is introductory phase. Introductory phase, now the patient and nurse and the patient get basic data information about each other. And the third one is working phase. Working phase, where both are performing, nurse as well as the client. Nurse is helping the client to meet his or her uh, needs regarding healthcare or healthcare challenges, to resolve the healthcare challenges. And at the same time, the patient will cooperate with the nurse to attaining the goal of client. And the fourth one is termination phase. Termination phase is the last phase, and the entire process, entire relationship ends here. And this is a phase where person can when the this phases arises when the person leave the hospital, or the person will discharge from the hospital, person took lama, or maybe the person will died in the during the treatment procedure. So this phase begins with the termination of patient. So as I have told you earlier, that first phase is pre-interaction phase. Pre-interaction phase, which denotes before the interaction, before the face-to-face interaction with the client, where when the nurse can collect data from the files or from the other person, from the duty in charge person, from the handover, or from the paper file, or through person's relatives, or any health team member. So this is the beginning phase of the nurse patient relationship, where the nurse can collect basic information about patient, such as patient's name, patient's diagnosis, uh, patient's address, or patient's gender, the basic information, the demography about patient. Now we move to the next. Nurse will perform some task in this phase, like what nurse will do in pre-interaction phase. First, nurse will explore the basic data, gather the data about patient. Then nurse will make a plan how she will or he will meet the patient, how patient will gonna respond to that nurse, or what will be the feelings of or fear of owns, which means how nurse will react to that patient. If the patient is anxious or patient is having panic attacks, then how the nurse will react. So the nurse have to explore his or her own feelings, own fear, own strength, own weaknesses. So this is a basic task which nurse will perform during the pre-interaction phase in the process of nurse-patient relationship. Now I'll come to the next, that is introductory phase. In introductory phase, as the name suggests, introductory means a introduction, a orientation, which means now the nurse and the patient met for the first time. They are meeting each other for the first time, or they are seeing each other for this first time, that she is my nurse, she is gonna treat me from now onwards, or the nurse will react to, oh okay, this is the patient, and these are the symptoms the patient is having at the current time. So nurse will find out the patient's problems, or she will determine what person's needs, what person's symptoms, what the person is complaining about, and she will understand each and every criteria and understand each and every phenomena during that period of time. With this, the nurse will also focus on the uh, determining patient's problem at a time. The nurse will also focus in for the resolving one. If the person is having a problem, like basic problems, if the patient is complaining about hospital setup, or patient is complaining about fear, anxiety, cold, calm, the environmental climate, or anything the patient is complaining about, at that time the nurse have to resolve that issue and to motivate that particular problem. If the patient is having suicidal tendencies, that time the nurse, the basic responsibility of nurse will be that she has to listen to each and every feeling, or to ask the patient to verbalize her or his or her feelings. At a time, nurse can motivate the patient as well. So this is all about introductory phase. What nurse will perform, what nurse's task will be in orientation phase. First, she has to create an trustworthy environment for the patient, where the patient can verbalize his or her feeling. As I've told you, that the nurse will allow the patient to express what the patient is suffering from, whether it is a physical problem, whether it is a mental problem. The nurse will allow the patient to verbalize uh, his or her part. Then the nurse will collect the data, like what physical symptoms patient is having, what mental symptoms patient is having, and what the patient is feeling about at the current time, existing time, when the patient is admitted to the hospital. So that time the nurse will gather the data about patient's feeling as well. And the third task or the next task will be nurse have to set the priority in the planning. When the nurse will plan what will be the when the nurse is planning about the alternate solutions for the patient, so she has to prioritize the interventions, like she has to take actions to resolving the priority wise. Now then, mutually explore feelings. In this task, the nurse and the patient will come together and mutually uh, they will explore the feelings, like if the patient is complaining about symptoms, like if the patient is having anxiety issue, or if the patient is having any physical problems like fever, cold, or anything, any symptoms, if the patient is complaining and nurse is neglecting that symptom at particular period of time, so they can't make a trustworthy relationship. Patient will never trust on that nurse. So the nurse and the patient has mutually understand each other. It is a basic, it is a priority, basic thing in nurse patient relationship. Without trust or without a rapport, a trustworthy relationship, the nurse and patient relationship cannot be possible, or that phase will never be proceed to the next phase. Okay, now I'm coming to the next point, that is working phase. So as I have already explained about something about working phase, as the name suggests, working phase means now the both are working. Both means the nurse and the client. Both are mutually working for each other to attaining the one goal, which is to resolve the challenges regarding healthcare of the client, or to meet the healthcare need of the client. So in this phase, most of the therapeutic work is carried out during working phase. As the almost problem is identified, now nurse will explore the solutions, and that explored solutions has been applied and evaluated by the nurse as well. Like if the patient is complaining about pain, patient is complaining about headache, then at that particular moment of time, nurse has explored the problem that patient is having headache. Now nurse will apply the intervention. She will execute the intervention, such as a nurse can give the comfort devices, ice bags. She can provide a calm and quiet environment to the patient, or she can she can help the patient to ease the symptoms by using music therapy, or anything she can provide which will be helpful to the patient. So at that particular time, the symptoms are explored, the symptoms are applied, intervened. Now this is the time to evaluate the applied interventions. What nurse has done to the patient to ease the symptoms of headache. So at that particular after that particular time or particular action, nurse will evaluate the own action. How she will evaluate the own action? Nurse will ask the patient. She can ask the patient to verbalize how you are feeling now. Are you okay now? Do you have headache? Still your head is aching? Like that she can ask, and the patient can verbalize. If the patient is not verbalizing, if the patient is not cooperating, that means the working phase is not successful. Both are not dealing or helping each other. As the nurse patient relationship, as you have seen in definition part also, it's a helping relationship where both are helping each other. Nurse is helping to ease the symptoms or to meet the healthcare uh, need to meet the health needs of the patient, and nurse is cooperating, sorry, the patient is cooperating that time. So they will and they will, a nurse will explore, applied and evaluate the actions which have taken by nurse only. The task which will be performed by nurse in working phase, she will gather the data and explore the other stressors, like other trigger points. Next, they can facilitate behavioral changes of the client, that if the patient is showing some negative symptoms, or the patient is not cooperating, then the nurse will motivate the client while making behavioral changes into patient, or provide opportunities for the feeling. Nurse can continuously ask, or nurse will keep asking on how the patient is feeling, how the patient is responding, the headache is still there, the pain is still there, what are the other problems. The nurse can evaluate all this. So these are the tasks. Then the last phase where the nurse patient relationship ends, that is termination phase. This is the most difficult and the most important phase of therapeutic nurse patient relationship. How it is difficult? Because it ends the process here. And how it is important? Because it ends on the basis of previous phases, like introductory phase, pre-introductory phase, or working phase. And the goal of this phase is to bring a therapeutic end to a relationship. Now the nurse and the patient has to mutually end the relationship. Therapeutic end means in a hospital care setup it has to be end. And how we can end, as I have told you earlier, maybe the person got discharged from the hospital, maybe the person got expired at the time of treatment, or maybe the person will getting a referral from the one hospital to another, or maybe the patient is taking lama. It is a procedure of discharge when the person can uh, leave the hospital without any medical advices, leave against medical advices, when the person is leaving hospital without any medical prescription or advice. So if the person are having these uh, situations, that is the only these are the only situations where the termination phase begins. So termination phase begins while the termination of the patient from while the when the patient got terminated from the hospital, whether he got discharged or whether he got expired or whether he got any reference. So the nurse's task at the time of termination phase will be establish reality of separation between client and nurse, and between patient, family members, and oneself, and patient mutually explore the feeling of rejection and sadness. And nurse can also plan for the future therapy needs of the patient. If the patient got discharged, then the nurse can help with the diagnostic follow-ups, or for the symptomatic follow-ups, and for the dietary follow-ups of the client. So these are the basic tasks which has to perform while the termination phase. So there are some characteristics of nurse-patient relationship. Every process, every phenomena has some basic characteristics. So nurse-patient relationship has as well. So the first one is it is the cornerstone of psychiatric mental health nursing. Why it is cornerstone? Because we have to observe and understand the patient's behavior. The moment patient got admitted in the hospital, we have to observe the client's expressions, observe the patient's verbalization, and we have to understand the behavioral pattern, the behavioral changes of the patient. Then the second one is it is a mutual learning and corrective emotional experience for the patient. Mutual learning, as I have told you, that it is a interactive, it is a mutual relationship between nurse and the client, between doctor and the client, between nurse and the client, between healthcare professional, among healthcare professionals. So it is a mutual learning experiences. Nurse will gain some experience from each and every client, and also the client will explore the feelings of another one, and he or she can express the own feeling in front of everyone. So it is a mutual learning experiences. Everyone is learning something in every setup. So it is a ongoing learning process for both. Now the next one is it is based on belief that the patient has potential as a result of person can uh, in this is the characteristic when the nurse have to, and in this process the nurse is identifying the potential results own while own actions and from the patient's actions. There are some components which are responsible to make a healthy relationship among nurse and patient. The first one is rapport. So rapport is a word which defines a trustworthy relationship. It will be a therapeutic relationship which will be occurring in a hospital care setup or in a therapeutic setup, in a treatment setup. So it will be a relationship where the client and the nurse will trusting each other, making establishing trust on each other, sustaining trust on each other, and understand each other. And second one is second component will be empathy. So empathy is a word when it is an ability, it's not a word, it's an ability to feel the patient and to analyze the situation, or to ability to analyze the critical situation of the patient. It's an empathy where we have to place ourselves on patient we have to understand the patient's phenomena from patient perspective. So we have to understand, we have to analyze, we have to calculate the circumstances and the feelings of the patient. The next is genuineness. The nurse, it is a basic thing, it is a basic characteristic or basic quality which every nurse should have, that is genuineness. Genuineness denotes reality, honesty. It is an ability to be open, non-judgmental, honest, real at a time, while the interactive while we are making interaction with the client. When we are interacting to client or to patient, the nurse has to be open, honest, real, and non-discriminative. So this is the basic component of nurse patient relation. This is a basic component of every. Then the next component is respect. Respect where we show regards to the other one, whether it is a old person, it is whether the patient will be a child, whether it will be a woman, a man, or anyone. We have to show respect we have to show the, we have to respect is to believe in the dignity and worth of individual. Like we have to accept every person's behavior. How we can respect client? We can take patient's name. We cannot make patient's bhaiya, bhabhi or any relative. We have to call the patient by patient's name, such as Mr. Mukesh, Mr. Ramesh, or whatever the patient's name is. Then spending time with the client. We have to spend more time with the client. We have to understand. We have to uh, we have to ask the patient to express his or her own or real feelings. So we have to spend time with the client. We cannot avoid patient's need. We cannot avoid patient's requirement. We cannot avoid patient's demand. So we have to spend time with the client, and we can allow the patient to ask questions if he is having doubt, if the patient members, family members or the attentives are having doubts while taking treatment, while taking any therapy, while taking any therapeutic uh, therapeutic modalities. The we can ask the members, or including patient as well, we can ask them to collect data. We have to uh, resolve their questions, queries at the treatment time. So these all are the situations or the characteristics where we can show the respect towards the client. We can show trust. We can feel we can make a confidentiality among patient and nurse. If we are making confidentiality, if we are making confidential or private conversation between nurse and patient, then the relationship will be trustworthy. We cannot open or disclose each client's reactions, each client's symptoms, each client diagnosis, or each client's sufferings to the another one. We can make a trustworthy relationship, which has to be there. So that is all about today. For this topic, if I have missed something, if I have missed any other component or any other characteristic or any other thing in phases or in definition, or you can, if you are required to take any definitions by different authors, so you can refer these books. There are n numbers of books in which are present in psychiatry department. Like you can go through with the Mary C. Townsend, you can go through with the Elsevier publications, practice and principles of psychiatry nursing. You can take help from R. Shivani book as well, or you can go with Kopal and Strott. There are multiple number of books where you can find the other data regarding nurse patient relationship. You can take help from the internet as well.